Hello, can you hear me? Honorable
Yes, I can
Wajani.
hear you. Good
Oh,
afternoon. Yes, I can. Good afternoon, everybody. And thank you so much for having me. Ms. Netme Obasuge, thank you so much for all you do. Dr. Loretta, you're not my personal person. Thank you so much for everything, for creating this time to be here this afternoon. Thank you so much.
Yeah, our brother in teamwork to move Edo forward. Well done. Well done for all you do from the youth angle.
mm,
Well done.
yeah. So thank you to Honorable Daniel. We appreciate your efforts, especially in the aspect of Edo youth. You know that the Edo youth, we have been through a lot. You remember the first day you came to this program, I was surprised. I never knew that we have a great youth like you in the state. Thank you so much for what you are doing, for being
Thank you very much, man.
an inspiration to the other youths in the state. So go ahead and introduce the purpose of today's program.
Thank you very much. Thank you very much, ma. First of all, I want to everybody to the second edition of this series, the Edo Youth Development Series. The whole idea is bringing professionals, Edo professionals, and people outside Edo State to mentor Edo youths or mentor Nigerian youths at large. You know, discuss on leadership and series of programs and challenges that affect the nation at large. Looking for a way forward in terms of what can the youth do, what can we do. And I want to apologize for the lateness. It was due to technical difficulties. We're supposed to have three guests today. We're supposed to have Dr. Amedi Osemudiame, who is a doctor and from UBTH, and was supposed to join us for the program, but due to some issues, he has not been able to join. Pharmacist Kevin Isoken was equally supposed to join us to help discuss on today's topic. Today's topic is awareness of COVID-19 and general well-being. Now, I'll leave that for Dr. Loretta to do justice to that, telling us on, tips on how we can prevent and manage COVID-19. In focusing on Edo State, in focusing on Edo, knowing that the youth make the vast population of this country, Nigeria. So I want to quickly, won't want to bore you so much talk. I want to quickly read the citation of Dr. Loretta, and I believe she'll be able to do justice to this topic this afternoon. So Dr. Loretta Odue Ogboro Oko is in the United Kingdom trained O&G doctor. She has been able to blend her work in science field and medical practice with being an author, a passionate motivational speaker, a woman and youth health advocate, educationist, as well as a social entrepreneur.
I'll go straight to what we are doing today. We are talking about awareness of COVID-19 and general well-being. It's such a pity that our other planned people are not here because we are giving a lot of flavor. But I'll do what I can do because I'm fortunate to be on both sides of the divide. I
Yeah,
live across Nigeria and the
Dr.
United Kingdom.
Dr. Lawrence, I don't want to cut you or
Yeah,
interrupt you.
yeah.
Before you start this program, I just want to say something about COVID-19 in Edo State because this program today is focusing on Edo State. Lately, it was reported that more than 700 people were diagnosed with COVID-19 in Edo State, during the second wave of the virus, while more than 20 people were reported dead in the state. So it's a kind of awareness to people in Nigeria, not only in Edo State, that COVID-19 is existing in Nigeria. Okay, because many people are still living in denial, saying that there's no COVID-19. Some of them are blaming the government that they are using this idea of COVID-19 to make money from the Nigerian treasury. But COVID-19 is existing in Nigeria because we can see that in statistics, what happened lately in Edo State. So go ahead, Dr. Lawrence. I just want you to keep that in mind when you are doing the analysis.
And to further buttress what you've said, and maybe because of my research background,
Mm,
I want to state that it's not just Edo State. And like you pointed that out, you see, we carry mobile phones about and we only spend it on WhatsApp, Facebook, and gossip sites. On the NCDC website, you have all this information. 2 days ago, the NCDC lead, he tweeted out, he does that regularly, you know, and he stated that we had 121,566 confirmed cases so far, and discharged cases, this is very important as well,
mm,
is 97,228. Now, another thing we should take note of are the deaths. The deaths came to 1,504, and importantly, samples tested 1,273,083. So this is looking at the Nigerian figure,
mm.
and Stanekman has given us the
The breakdown.
Edo State
Mm,
figure as well. So we can see that these figures don't lie, data don't lie. So it means that there is a burden. COVID is actually there, and there is a burden that we all need to tackle. How do we tackle it? We can look at other people and get a fair idea, but we cannot swallow what other people do hook, line, and sinker. We do need to domesticate our own to suit our cultural and socio-economic milieu. So if you look at other countries, when COVID came onto the world, we were all taken by surprise. Nobody thought that from the small village of Wuhan that this is going to be a tsunami of sorts for the whole world.
for the whole world.
But as the days go on, people are working hard in laboratories and seeking to understand. Health workers, technology, everybody is trying to work hard as a team, seeking to understand what is happening. So we know that one, I will use very simple terms and keep it brief. It's a virus. Two, you can contact it by certain measures, and you can protect it via certain measures. And interestingly, on the NCDC website again, you are going to see some online courses. It's available for every Nigerian to go there and click on and just do it, whether you're from Edo State or Zamfara State. And they are looking at things in three broad groups. They are saying standard precautions. Then they are saying the use of personal protective equipment. And then they said environmental cleaning. So you can see the three big headings. And even in other climes, these three big headings is what they've worked with. Standard precautions. How would you maintain standard precautions against this virus? We know that one, we need to optimize our own personal hygiene. So if I crack down into Nigerian youth, and then if I narrowed it down into the Edo State youth, and juxtapose it with what the youths in other parts of the world are doing, we can sort of find out common grounds or where we are missing it. So as a youth in Edo State, what's your own personal thoughts about as to how you can contribute to reducing the spread of COVID? And the answer is this: are you first and foremost thinking of others? And then are you thinking of yourself? Because we also found out that the disease, when it happens in people who have underlying infection,
Mm,
it can have worse outcomes. And most times, those who have underlying infections are the older ones amongst us. So, as a youth, are you acting responsibly? Do you have a grandmother in your house? Do you have older aunties? Your parents are older. What do you do? Do you still dodge out and go for parties? Do you go there and don't observe social distancing? We are not saying isolate and live in your house except you're in a high risk group. But what we are saying is, are you acting responsibly when no one is looking? What are you doing? Are you still going out and you hug people? I watch us in Nigeria, and I wrote a piece recently where I said, is poverty a protective factor? And that in itself was more like a satire, but it was pointing out certain things we do. Okay. So if you are poor, you are unlikely to have money to throw a big party. That's the truth. So this societal strata where you have the parties being thrown is the middle class. But then again, if you are in the lower societal strata, you are more likely to run to church to pray for God to bless you. We find that in more resource proficient or prolific countries, the churches are empty. That's the truth. That's the data.
Yes.
So in going to churches in Edo State, for instance, what are the church providers and leaders taking on themselves to make it safe for those who will come? And as a youth as well, are you enlightening, because you have more access to internet? Are you enlightening your older mother that goes to the market to say, mommy, this is why you have to wear face mask? Are you dispelling the myths and say, mommy, oh, they say face mask can make you lack oxygen, but it's not true. This is what I just read, except the car reason why you shouldn't wear it. Are you explaining to her that, you now
Dr. Loretta, can you hear us?
I was wondering because I can't hear her anymore. I was thinking it was maybe my earphone or something.
Can't hear her anymore. Oh, okay. She will log in again. No problem. She will come back.
So while we wait for her, would want people to send in their questions and suggestions, because most recently the governor of Edo State, through the deputy governor, launched a task force to make sure that people are law abiding, because the whole idea of using face masks has become in short, it's there's a penalty for not using face masks. Right now in Edo State, don't say you did not hear. They are arresting people that do not use face masks, because truly they said prevention is better than cure. So in as much as we are trying to prevent COVID-19, we must try our best to stick with the already existing guidelines that will help us prevent the virus. Not just for us, but for our loved ones and people around us. We must do our best to stick with the guidelines.
So I think I have the video. Let me just play it for them to see. I have the video here. No problem. Yeah. Can you hear us?
Yes, very well. Can you hear me?
Yeah. Before you start your discussion, let's quickly play this video of the constables that the government, the Edo State government, just implemented. It's a kind of a security outfit. Let's just play it and listen to what they are saying here.
So why are they not doing this very well? What is the they want to do that? I'm just coming from the bank. to enforce to make sure that nobody enters here without a face mask. He is not wearing it. So what do you think we should do now? Eh? I'm giving you last warning. But 1, 2, 3 will go with us. They will go for test. 1, 2, 3, they will go with us and we'll go for test. The next time we'll flag this your issue now. We'll flag it. The next time we'll come here and we'll give anything, we'll close it. The next time we come and there's no adherence to COVID-19 protocol, we'll close it. I'll give you the last opportunity. But these 3 will go with us. We'll go for screening. Dr. B. So we'll get them. You are not wearing it for me. You are not wearing it for governor. You are not wearing it for. You are wearing it for yourself to protect yourself and others. You understand? COVID-19 is real. It's real. Social distance. You see, all of you are still model up here. You are still model up here. I'm not trying to get them to social distance. Collect their money without being inside this hall. You can face them. This whole crowd can take their money without all of them being in this hall at the same time. Nobody's doing the physical signs. See your signs. Look at your signs. Nobody is enforcing it. From the gate, you should enforce. You have it on the ground. We ask you guys to even do a canopy outside. They can sit down and be entering and collecting their money. Let them have one wash station. You guys didn't go for training. Why is it difficult for you guys to do your hands legs? Why is it difficult? Just hey! Hey!
Okay. Yeah. Hey, can you hear me?
Yes, I can
Is
hear
that
you.
not interesting? So
Yes.
interesting. So
That
interesting.
was a very good clip, and I'm glad you played it because I was saying something I said before the technology glitched. Personal protective equipment. You know, you can see from the name, it didn't say Neckman's protective equipment on behalf of Loretta. It didn't say Danielle. It says personal. It didn't say Schwaibu's protective equipment. You know, it is yours. It is for your own protection. And that's what the deputy governor was trying to say in one part of that clip we just watched. And it is interesting because if you are trying to enforce something, like he said, you are not wearing your face mask. How are you going to enforce it? And I want to point out, in comparison as well with other countries, people often wonder, how did China get a hold of their virus status, the numbers? How did they reduce it? The answer is simple. In China, people are very used to obeying instructions. They are very used to obeying orders, even a lot better than in Europe and in other countries. So once there is a law in place, people are very used to, right from time, probably because of the communism, they won't question it. They will do as it is said. And it has helped them with this pandemic. So when you say wear a mask here, they will wear their mask. Keep it on XYZ, they will do just that. Even in Europe, you find that people were initially very disobedient, and they still are. Now, fast forward again to Edo State, and you see that is the same problem we have. Because you can see in the bank, the signs are on the ground is marked, but people are not obeying. So the question is, how do we get people to obey? One, we need to keep talking like we are talking now. Two, that task force that was inaugurated is a brilliant idea because those people will now stand and say, ah, Madam, Oga, this is where you should stand. Please move backwards. And one thing I want to stress, the fact that you are in task force does not mean you should be rude and scream at people or shout because we are very used to that culturally. These task force people should also be taught soft skills. So, Nekme, imagine that one of our EA or Ray Bank or Rigo translated, one of our elderly mothers wants to collect money in the bank and they are in a queue and they are all so close. Imagine if you come and say, Madam, 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 now, oh, yeah, me, una, move, una, shift. Versus you come in and you say, ah, Mama, because of this coronavirus, it is spread from person to person through air. We need make we get 2 meters between us. So, Mama, stretch out your hands. You see the sign now. And here you suppose stand.
Mm.
We are moved.
The way you are
Those who
saying it,
never
I
reach
see.
their turn, stay outside. You see, people will be a lot more receptive. So these are things we all need to fashion into all of these programs. And the youths play a key role. The reason is because one, they have the energies to, is that time of life. And two, they have access to unlimited information, like I pointed out before.
Mm.
So as an Edo State youth, in your own space, in your own time, what can you do? Don't think that there's not something you can do. There's something you can do. You can volunteer to be part of these task force as well. That's one thing we are lacking a lot in our climb, volunteering. I enter a big supermarket here and I find people, they are volunteers. They stand there and they remind you, oh, madam, your face mask is on your chin. Wear it properly.
Yeah, exactly.
You see, the way that we have to proffer these establishing that there is COVID-19. I mean, when we started this program, you and I came up with the data from very reliable sources
Mm.
that this is what is happening. But that data is in big English. It needs to be translated, into our various languages and into various jingles. And then importantly, those of us in that country now who have had COVID-19 and survived, we need to be talking about it because it's still shrouded in secrecy. The other day, I was talking to one of my friends. She said, I've been get COVID though. I did house. I don't want to make anybody know. I not tell anybody. I said, no, that's wrong. You tell your workplace people so that they know. He said, I just said, I know well, I'm off sick. But then she had a positive COVID test, from a reliable laboratory.
Mm-hmm.
So I said to her, no, 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 no. Tell everybody in the office that you have COVID. Because what that would do, they will say, if our guy can have COVID, that means it's real. All of us can have COVID. Now, she listened to me. What she then did, she snapped her result and put it in their organization's WhatsApp social media handle
Mm.
and said, oh, this is why I am off sick. And then 2 days ago, she called me. She said, Loretta, I want to thank you. I said, what? She said, all my staff now wear their mask right. And they now use their hand sanitizers properly.
Mm.
I said, so how did you know? He said, before I went off sick, we had hand sanitizers. It was full. It was not moving. It wasn't changing. She said, but in the past 3 weeks, after I put my picture there, we are now having to replace it regularly. It is being emptied. That is a very objective assessment that people are now using it. And she said people are now wearing their mask as well and maintaining social distancing.
Okay.
So what you pointed out, a Nuta one is right, you know. But instead of our people having it to come out and say, this is what is happening, this is the cause of death in some places, they are still shrouding it. They are running abroad to take vaccines. They are running abroad to find treatment where they can. But they forget that it's not everything, like COVID has also shown, that can get on the plane quickly enough. So we also need to develop our own healthcare systems
Oh,
As we are developing our social response and soft skill response, we need to put the hardcore things in place as well. And then we need to teach people how to use these things. It's not enough to buy equipment and people don't know how to use it. And then let me point out something as well, Nekme. Let's talk about this. Must we attend birthdays, weddings at this time? Must we flout the rule of saying in the church it should not be more than 50? Some churches have been very good. They've broken their service into 3 or 4 on Sundays so that there can be social distance in between the chairs. But then you still find that others are cutting corners. My question to you is, is it that we cannot just, are we cursed? Translated. Is it that we can't just obey rules? Because the rules are there. You can see it.
but
Like the deputy governor is showing, the rules are there.
what I wanted to say about this COVID-19 in Nigeria, mostly in Africa, it is time for us to prioritize certain things in the society, especially these critical times when we are facing a global pandemic. So church can be postponed for a while, to curtail this the spread of COVID-19. We can do that. We can pray at home. We can do online service. You understand? So I don't know. I still don't know why they are still conducting churches every Sunday. People will be all crowded in one church. What is that? What is that?
But
You
there
know,
are guidelines. There are guidelines. I think even though
what
we don't want to
guidelines?
stop it, we can adhere with the guidelines. If it says 50 people, then 50. If it says 20, then 20. Let us learn. In the Bible, people were seen obeying God. And the rules of the land is our God on earth per se. Okay. If you love your neighbor as yourself, you will obey the rules. And if we say close the church, will you close the market? Will you close New Benin? Will you
No,
close Oba
that
Market?
essentials. Like in Canada, for instance, we have what we call essentials, like the supermarkets. We are open because we can't live without food. So, but for the churches, we can do without going to church for 1 year, even 2 years. We can pray from home. That's what I'm
But
trying
your
to say.
people have not realized that church resides within you. And in that social-cultural context, that's what I'm trying to say, that we need to understand our own social-cultural context. In our own social-cultural context, Nigerians believe in a physical presence in a church. Edo State people believe in a physical presence in a church. So if that is it, that that we should find a way to work around it. And the government has done, they've produced rules and say, oh, this is the number. But we need to observe it. And you just said something about essentials. Essential other markets, New Benin market, all the markets, they are essential services. But there are also rules. I look at the market women and they are not wearing their mask properly. Yes, one the other day said it's too hot.
This is echoing. Oh my God, it's echoing.
I think someone's, yeah. So you see that sometimes it is the obedience or the adherence to the laid down guidelines, because even in the essential services in other countries, we also have rules in place that guide it. You have to wear your mask. You now have to go shopping by yourself alone. You don't have to go with, like, before, if I was going shopping, I would take my daughter, my son, my mom, everybody will go shopping. But these days, the rules are there. Come alone, come by yourself, make your decision what you are going to buy. Come into the shop. Don't pick item, look at it, drop it. Those things are in place. And people are adherent. The question is, social culturally, we cannot close our New Benin, we cannot close our Oba market, but we can be able to do our bits as a market woman to say, okay, how can I help with the general hygiene of keeping COVID at bay? And those are the questions we should be asking ourselves, translated. How do we do this? Are we going to put these newly inducted, um, what did you call them, Nekme? Those people marching just now.
Special constabulary
Yes, especially,
police.
are we going to position them in each market so that they nicely tell the market women? I emphasize nicely. They must be cautious. They must also be respecting of the other people. It is not a time to bully people or to beat them up. If not, you are just creating a new set of agberos. They should be nicely reminding our mothers and
Oh,
sisters
not
and
in
brothers
Nigeria.
and fathers and saying, "Oh, are you wearing your mask? Esheduwana is too close. Move your tray."
But you should know one thing you should be cognizant of, Dr. Lorenta, that in Nigeria, if you are not tough, people don't listen to you. You know that. You know
Yes.
your country. So if you go there and say, "Oh, madam, remove your," they won't even treat you seriously. They will just look at
No,
you as if you are
that's
wasting.
not
I'm not, I'm
true.
not saying that I'm trying to
I,
support the
I,
aggressiveness that is.
I would disagree. Let me tell you why I would disagree. Um, I have led in different capacities, and I still do in Nigeria and out of Nigeria. Um, People respect being respected. They will eventually listen. You see, where we have a problem is the patience to push past that curve. So when you start pushing, oh, everybody use your face, nobody's going to listen. Okay. But assuming I came there with a megaphone and I still say what I'm saying now nicely and it's very loud, they will listen. So we should find ways to integrate niceness into our own culture. We
Nigeria.
should find what works for us.
Mhm,
They will listen and they will get past it. It's not every time you wield a cane
mhm.
or you become very violent and aggressive. And it
Aggressive.
works. And I have done it.
Aggressiveness.
So I
Yeah.
think we can do it and it will work as well. We
This
just,
this special constabulary police, I think they are doing a wonderful job with what we
I
saw
agree.
from the video. Exactly.
I agree.
These people
But
at home, they know how to regulate their people. You understand? So them that set up this task force, they know why they set up the task force, and they know how to
I agree with the
enforce
task
the
force.
law. They know how
I
to
agree with
enforce
the
the
task force. What I'm saying is, as part of the training for the task force, we must teach our people soft skills.
law.
We must begin to do that, Nekme. You see, culture is not dynamic, thank God. Culture is not static, thank God.
Yes,
Culture is dynamic.
dynamic. Yes,
Okay. So
it's
even in our
fluid.
tackling of COVID-19,
Mm,
maybe COVID-19 helped us to come and find out how we can also improve our culture. These constables should be taught how to respect other people in the discharge of their
it
duties.
is.
It is very important.
Yeah.
We don't always need to be aggressive and
Aggressive.
to shout. No, we
Nigerians
don't
have
all. We should find new ways. After all, we're not always like that. We're not always like that.
been.
Sometimes it is the hunger, the heat, the that brings out the aggression. Why is it that in Canada Nigerians are not being unnecessarily aggressive?
Yeah, it's the system that's
Exactly.
regulating their
So
behavior.
it is us that we fix our system, and maybe that's what COVID-19 has come to help us do.
Mm,
And who better to lead this than the youth? Because they are still in their formative years, not those who have ossified, those who you can't change anymore.
mm, okay. So in Nigeria, the first time I visited was not 4 or 5 years ago. I visited Nigeria. I was sitting inside my brother's car, staring at people in the streets. They are so aggressive. They curse. They insult themselves. They fight. I was wondering. I said, "What is going on in this country?" This country was not like this when I was young. I was born and raised in Nigeria. I've never seen anything like that before. How come people are so aggressive? Like everybody understand the system except for Lemi. I was so surprised. They said, "Calm down. You're gonna use to the system." I said, "Not me. I can never use to this type of system." Honestly,
Yeah.
people are so aggressive. They curse. They curse. They talk.
We can't keep doing things the old way and expect new results. And that is what COVID-19 has done. It is, they call it something that has created a new norm, a new order. It is our opportunity, even with those states, Nima, take the opportunity on how we can make things better. Let's take the opportunity to make things better. You just gave an instance. I will give you my example. I went to a certain place in Benin to buy something, and I went with someone else. So when I got there, I said, "Oh, good afternoon, madam. Please, I want to buy XYZ." And she didn't answer me. She was talking to the man behind me because I went with a man to the shop. And I said, "But madam, I just greeted you." She didn't answer.
Because they're not
And
used to that system.
and then she was looking at me. I said, "No, you will answer. You will not answer that greeting. It's very important we establish a rapport." She said, "But I'm telling him the prices of the thing. After all, he's the one that is going to pay." That's what she said. I
Uh,
know someone may think this is not linked to COVID,
oh,
but
okay.
in really sense,
I
every
understand that. Yeah.
our cultures,
Mm,
we need to overhaul them. We need to do what I call cultural integration.
yeah.
Take the good things in your culture. We have many beautiful things in our culture,
That we
and
have to keep.
discard the bad ones,
Mm,
and then get some good ones and add.
mm.
And I told her, I said, "Well, for your information, the man is not paying for what I'm buying. And number two, I think you are not very receptive. Can I please see your line manager?" She said, "What's line manager?" I said, "Your manager here, anybody who manages this shop." And she went and called the manager.
Ah,
And in fairness, the manager came and apologized. Now, let's look at that in the context of COVID. If someone came into a shop and that kind of person, the way she was behaving, wants to tell the person to wear mask, what do you think? How do you think she will say it?
you see the behavior that
How,
lady
she,
does.
exactly. She will say, "Get out, go and wear a mask and come back." And that's wrong.
That is the system that the Nigeria as a country is operating. The type of behavior the young woman or young lady just exhibited is the stereotype of an average Nigerian. That is how they behave there. So you coming out trying to kind of question her behavior is something that is it's not very
Yeah,
common
but
in the
if you
society.
question, I question,
Yeah.
Daniel Owadia question, we start questioning. We are having this discussion, which is why it's good we are having this kind of programs. Our society will change. Our society will only change when we decide to change. I always say it is only Nigerians that can fix Nigeria for Nigerians. It's only Edo State indigenes or people that can fix Edo State for Edo State indigenes.
Yeah, I
It's
understand.
not any other COVID or outside of COVID.
Like what we discussed this morning with Mr. Oraka, I was saying that the problems facing that country are too complex. Even sometimes it's difficult to even name them and provide solutions to them as well. So in Nigeria, if we have to look at it from a broader scale, the problems facing that country, we have to address the social problems, then like how people behave, their behavior, the aggressiveness in the street. That is another big problem that we need to tackle in Nigeria. When it comes to institutions, corruption existing in institutions like the school system, even the family. I always say and continue to maintain on this program that corruption in Nigeria should not be limited or addressed in the political sphere of the country. That corruption exists in every fabric of Nigerian society, from the family to the school
I share
system.
that view with you.
Oh,
We know what the problems are, but we can't afford to give up on whatever is happening. We have to keep pushing because the societies that work, people are pushing. People don't stop. I mean, that's why you do what you do. That's why Daniel Wadia does what he does. That's why I do what I do. Because a team is only as strong as its weakest link. And the problem in Nigeria is that we have so many weak links, starting from the family setup. And the
oh,
family setup is the unit of the fabric of
so
the society.
society, the socialization starts from the family.
Yes,
You understand? That is what I always repeat on this program, that in order to straighten a child, you have to raise that child in a corrupt-free environment. I know that corruption exists in every country, but the one of Nigeria is like a pandemic. You understand? When you raise a child practicing corruption in front of your children, and the children will go out there, go to school. What do they see or what do they learn in the school system? Corruption. In universities in Nigeria, they practice corruption. Professors collect
And,
money from them, bribe.
and
They
it
do
is
all
this
kinds of things.
corruption. It is this corruption. Sorry to interrupt, but I just need to say it is this corruption in the very fabric of our society that is making Nigerians doubt the ruling class that there is anything like COVID, because there has been a persistent corruption streak in which
This
there is that when COVID started, that people were donating 1 billion, 2 billion. That where is all that money? What has become of it? Nobody's hearing about them anymore. What have they done with it? And the person said, well, he also heard that people were inflating the numbers of COVID positive people in their states
Mm,
so that they can just get money. So the
mm.
average Nigerian citizen is very suspicious of them
Distrust.
ruling class, and the average Nigerian is
Mm,
suspicious of each other. So if that's what's happening at the Nigerian level, it also translates to the state level. So
mm,
there is a lot of suspicion. And to make that
mm,
suspicion go away, we also need to tackle corruption. Because there are those that
mm,
believe that any money you bring out for COVID right now, even to buy test strips or test kits, sorry, that they are not being put to the proper use. Therefore, why should I bother myself?
Let me give you one example. At the beginning of COVID, you know that the politicians were diagnosed with COVID-19, especially the governors. It was like, oh, what is going on here? Is this COVID only for politicians? So Nigerians, they have already lost trust for these people, distrust in the system. They don't trust the government. And the first set of people that came out telling us that they were diagnosed with COVID-19 were the politicians. These are same people that we don't trust in the country. So that is why it's very difficult today to shape the perception of an average Nigerian that, or convince them that see, there's COVID-19 in Nigeria. The first person that came out and told Nigerians that hey, he survived COVID was Nasiru Arufai, the governor of Kaduna. How dare you? How can any Nigerian who knows the system, the corruption in the system, believe what Nasiru is telling them? So that is why till date it's very difficult for you to convince them who want to listen to you. They don't want to listen because they believe that the government is using the system of this idea of COVID to make money from the Nigerian treasury. So that is why I keep saying it on this program that we have to learn how to give these people the awareness about COVID. If somebody like me is telling Nigerians that there's COVID in Nigeria, I think they will believe me than governors or politicians in Nigeria telling them that there's COVID. If, for instance, person like Dr. Obano in the United States telling Nigerians that there's COVID in Nigeria, as far as it's not working with any government body, they will believe than a politician in Nigeria enforcing the law or regulating preventive measures of COVID.
Out as a face for the youth to tell them
Tell
that
me,
COVID is
if I'm not
real.
right.
That is why we should keep talking about the data. Now, Center for Disease Control website. And the truth is that people like Dr. Obano, yourself, Daniel, the everyday man and woman on the streets, we should also continue pushing. We shouldn't get tired. And we should be giving the information in simple terms. Make we dey tell them, say, this COVID not be for only Oyibo people or say only for the rich. You know, this COVID, they respect people, but say some people feel they catch and they spread and pass others. Now, true. Because
Okay, thank you very much. The fact is, I've had friends die of
Mm,
COVID. I recently, my very good friend Ubon King died in Lagos. I was diagnosed of COVID, was being managed, but died at the Lagos State Teaching Hospital. I think one of the hospitals in Lagos, the intensive care unit. He died of COVID.
mm,
Now, the general problem we have as an average Nigerian, like you said, everything in Nigeria is very political.
mhm,
You have running nose, it becomes that of a budget running of billions, it becomes a very big issue. So because of that, it's very, very, very difficult for an average Nigerian or an Edolite to believe there is COVID. Even the market women, they'll say, I beg you, you are trying to tell me not to come and hustle when they have made so much money. I beg you, the COVID no yahuria. They use different terminologies to tell you that COVID is not real. Because truly these people, they expect that, I should have COVID now because I work in the market, people are buying things from me, we're exchanging hands and all of that. But the fact remains that these people forget that because of the kind of lifestyle that they are living, to a very large extent, it doesn't help them manage COVID. The fact is, I have friends that have flu or cough and do not take medication. It goes automatically. This set of people, you see, most of them, they are not under the air condition. They're exposed to, the kind of lifestyle these people live, you know, automatically helps their immune system to manage and fight these infections. The fact is, COVID-19 is real. I've had, like I said much earlier, I've had friends that have contracted it. I have a friend currently that is struggling with COVID here in Benin City. We've not been able to see. We've just been talking on phone. He has gone with different methods. He said they take ginger, water, heat. He lost smell. All of the symptoms that has been accredited to COVID-19. He has everything in full. But the difference is he can still be able to move around, but he has tried his best to stay away from people. Some people tell you, I beg, hug me, which am be COVID-19. COVID-19 don't bath. Give me beer, which am be COVID-19. COVID-19 don't bath. The fact is, a lot of people that are dying of COVID, a lot of people do not know them because they are not on the internet. They are not online. They are not online. So this should not stop the average Nigerian youth to keep telling people that COVID-19 is real and it's taking a lot of people, and it has the malaria symptoms. It has almost the same symptoms as malaria. So when people have malaria and they treat it, even at the back of prescription, they say after 3 days, if this prescription does not work, please contact your physician or contact your doctor. Why? Because averagely they've given you drugs, and the way the half-life, the way they made this drug, it has made that in the first 2-3 days of taking this drug, there should be improvement in what you are taking this drug for. But if there's no improvement, contact your doctor. So for you that is treating malaria, that have been treating malaria for 2 weeks, my brother, my sister, you are no longer treating malaria. So basically that's it.
But misdiagnosing, I will leave that for Dr. Lorenta to elaborate on. In Nigeria these days, whenever anybody dies, they just many people will say it's COVID. So, Dr. Lorenta, go ahead.
Thank you. The fact that we are wrestling COVID everywhere in the world does not mean that we should lose sight of the other illnesses and diseases that happen as well. And if I look at the NHS, yes, we have found that in the COVID first lockdown, a lot of people who had other illnesses, not COVID, were even reluctant to come into the hospital. And recently, a few days ago, the NCDC lead, Chikwe Ihekazu, he tweeted and said that it doesn't mean that because of COVID, we are not going to respond to other infectious diseases in Nigeria. And he was specific. He said something like Lassa fever. And even Bill Gates said something recently. He said he will want to advise Nigeria not to join the competition and start racing to get vaccines, that they should go and develop their primary health care system. That is where he thinks, in his opinion, they should spend money on. Okay? So all of this point to the fact that there have been other diseases before COVID. There are other illnesses and there are other infectious situations and that people have. So if, and Daniel has said it, if a patient walks in, let me tell you a story. 2 days ago, a patient went to a hospital in Benin. He was begging to be seen. He had chest pain. He did not have any cough. He has not traveled recently. And they didn't see him. They said he should go and bring a COVID test first. I found that really, really silly because what you do is ask questions that screen the patient. So, have you traveled recently? Do you have a cough? Have you had fever? Have you been treating malaria for more than 3 days? In our own country, that's a question we should put, you know. And if that all of that answer is no, 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 then you take that person to a particular side of your facility. If the answer to those questions, any of it is yes, you take the patient to another side of your facility. That's what we are doing here. We have what we call the clean side, and we have what we call the side where you have the high risk patient. And we test every patient that comes in. Every patient is tested. But more so, those who have answered yes to some of those questions. So to say that you are a healthcare facility and you don't see a patient at all, it's negating your oath to do no harm and to help save lives. We need to find ways to work around these things. Your nurses, your receptionists, we tell the people be at a social distance, wear your mask, and they screen them. So if you then decide, like for let's take Edo State for instance, if I am one hospital, maybe Jesus has Jesus has risen maternity home, for instance, and they bring a patient at the door, there should be somebody that will ask all these questions. And when there is a yes, I've been treating malaria for 4 days now, it's not going away. Madam, I don't think we can see you here. Take this letter, go to Central Hospital. If all the answers are no, okay, madam, we can see you here. Come in. And we still see you, but we'll maintain all the precautionary measures and still treat everybody as COVID until proven otherwise, because there are those asymptomatic carriers and those who just spread it happily.
Yes.
Okay, but to say that you are not seeing patients like that, I was told recently, you don't even talk to them, don't, that is wrong. Let us work within our own cultural milieu and begin to find our own answers to our own problems.
Are people being stigmatized or being diagnosed with
Yes,
COVID? I think they
yes,
are
they
being
are.
stigmatized. That's why some people, even though they are diagnosed with COVID, they don't want to disclose it to the public because of the stigma attached to it. I think so. Right now,
That is why people need to understand it. It's an illness that it can, in many people, many of us may have had COVID and not known it. Remember that about 90% of people recover without any symptoms. So it is not something that, oh, death sentence when it happens to people. But unfortunately, another 10% will suffer seriously with COVID. And it is that 10% that matters, because one person's life matters. The life of every single Nigerian patient matters. Nigerian patients are worth it. Everywhere they are worth it. So this is why we devise our own methods. How many private hospitals now have developed their own screening questions? How many private hospitals have sat down and said, we are always treating typhoid and malaria? So one of the questions we'll ask is, have you been treating typhoid for 4 days? Have you been treating malaria for over 3 days? How many of us have sat down and studied our environment? Researchers are there in the university. How many times have we got grants to actually research our own societal response 19? Nekpe, our budget for health in Nigeria is only about 4% in the whole Nigeria. Tamame, tell me, how is that going to make a difference? Look at the money other countries spend on health.
and that 4% in a corrupt society like Nigeria, how many will go to the system directly to the system?
Exactly, when corruption has taken from it along the way. So maybe the part that
God have
finally gets
mercy.
to the average
Oh.
Nigerian is maybe 0.5%. And you say that they need to believe the ruling class. Unless and until the ruling class begins to act in a way that is believable, and unless and until the followers hold our ruling class accountable,
Table.
things will keep being done the same old way and we'll keep getting same old results.
So let's narrow it down to Edo State. Okay, focus on Edo State. This special constabulary police. I hope they will be able to enforce the law and regulate COVID, regulate the spread of COVID in the states. It's very important. And interstate travels, interstate movement is still going on, even though they are regulating it in Edo State more than other states. It's still the same thing because people are still moving from other states. The movement is there, mobility is there. So, in this case of COVID, Nigeria is a complex country.
We've really said a lot today is
Mm.
the government must focus on rehabilitating the primary health sector, you know, the PHCs should be equipped, should be, so that little illnesses or challenges in terms of health can be managed at the primary health centers. Instead of over, because that's one of the issues that places like Central Hospital and UBTH and other, are having today. The fact is, we don't have doctors. We don't have doctors in primary health centers. If you even have doctors there, they don't report to where they are supposed to report to.
Maybe Daniel, maybe we don't need doctors in primary health center. Maybe we need to empower our nurses. We need to train them properly to run these centers. And when you say the government should ensure, who is the government? You and I are government. Every citizen of Edo State constitutes the government. Do you know that we have a problem with our health-seeking behavior? I can have a primary healthcare center in Ugbogui now, state of the art. Iwa Boyoga, I will build it there. Instead, they prefer to go to the pastor. The question is why? Why is this happening? The question is why. So if you train people properly, if you train and empower the nurses and you have one doctor, so if you have maybe 20 nurses and one doctor, you can do a lot. You empower those people. And how do you empower them? People run to the pastor because the pastor has time. They listen. Have you been to a typical doctor or a nurse here in Edo State? There was a place I went to one day. Doctor, what thing you give me so? Nurse, what thing you give me so? I bet, madam, but no ask us question. Doctor, don't give you. Go chop am. And then you go to the pastor and you're even saying, pastor, what is this? It is holy water. I traveled to Israel to get this water 10 years ago. Then I fasted and prayed on it for 40 days and 40 nights. Now tell me, who will you go to tomorrow? Are you not going to go back to that pastor?
The pastor.
So we have a societal problem that COVID is unmasking. COVID is unmasking these things, and we need to start doing things differently. It's not enough to say the government should provide healthcare centers. Do you know that Edo State government right now is led by God, is on a drive to actually provide healthcare centers and renovate old ones? But the question is, are the people assessing it? Are your market women prepared to go there? What is our health-seeking behavior like? If you have a headache, do you choose to go, or you say, it will get better, let me just manage. Let me go to chemist instead. So we need to empower our nurses. We need to train them. Even in my own particular field, obstetrics, we can actually empower our traditional birth attendants. And we have to teach them when this is happening, when woman don't do labor, son one set 2 times, send the woman go another place, like big specialist hospital, so they can take care of the immediate ones. Nigeria does not even produce enough doctors for herself if we all stay in the house. Talk less of when more than 50% is outside the country. So to say you want a doctor or you want doctors in the primary healthcare center, one, you must make it attractive. You as a young man now, will you go and stay in Ugbogui and be earning 1,000 naira? So the salary must be higher than the person that is even in the city to keep them there. And we must empower our nurses. I tell people the difference between care in Nigeria and care outside of Nigeria is empowered nurses and other healthcare providers. So the pharmacists, even the porters, the domestics, everybody is empowered and they understand that they work as a team with the patient at the center.
In Nigeria,
That is what we should.
I don't want to
Yeah,
continue.
go on.
In Nigeria, we have seen that over and over again in the system that the only people who are getting enough benefits in the system are the politicians. They are well compensated. Look at the security operatives in the country. They are not well, the police are not well paid. No morale, no compensation. That is why they are not carrying out their jobs properly. So in Nigeria, even in the healthcare system, the same thing. They are not well compensated. If you are compensating people properly and proper regulation, I think they will do their job more better. And the training is not enough. It's not enough. Like in the West, people, training,
Update.
all the time.
I use the word empowerment. We must empower our nurses, our healthcare providers. And I love nurses and midwives. I value them because as a doctor, when I go onto the ward, I don't spend more than 10 minutes with one patient and I'm
Yeah,
gone. But they are there, even in COVID-19 fight, they are the ones inside. They have longer contacts with the patients. They are they are in the eye of the storm. So we must empower them. We cannot get past it. We can't dodge it. We must go back to the drawing board. We must build a bottom strong system, top approach to our healthcare. And we must teach ourselves, in those states, how to seek healthcare as well. And you can't have a hospital and people don't go there because of lack of confidence in that system. We must start bringing up their confidence. I asked Daniel just now, why do people prefer to go to church than to go to hospital? If I have a healthcare center now, why are people not coming there? Why are our market women not using our facilities? What stops us from having a little container in the center of our market? I will, madam, here another check a blood pressure. Nothing stops us. These things are
yeah,
all doable.
yeah. It's doable better. The system, the structure of Nigerian system. That's why we have been demanding for restructuring of Nigeria. It encompasses everything that we are complaining about right now. We can't be quiet, okay?
Yes,
We
so
can't be quiet here in diaspora watching our country going in flame. Our people, the civilians, are suffering in that country, while the politicians are enriching themselves and their families. So we can't be quiet. They need to restructure that country. It encompasses everything that we are demanding for from the federal government. Okay, the healthcare system, the insecurity prevailing in the country right now. Insecurity right now in Nigeria, people are afraid to do interstate travels. I grew up in Nigeria. I've never seen anything like this before. People are afraid to travel from one state to another. How long are we?
Yeah.
Electricity in 21st century, we don't have steady electricity in Nigeria. There is a particular area in Ondo State the other day. They said more than 10 years, they haven't seen anything like electricity in that region. So what is going on? We are not moving forward. So we have a long way to go. That is what I said before. I continue to maintain that the problems facing Nigeria is just they are too complex, and sometimes it's very difficult to even provide solution to it because of the corruption embedded in the system. So we have big problem in that country. I will continue to be advocating from the West.
but they are listening. They are listening. Change takes time, but the only constant thing in life is
Yeah.
change, and we
Yeah.
should keep pushing. And like I said, COVID-19 has come to unmask a lot of
Uh,
defects, even in our sociocultural
mhm.
environment. So we should try and work around our individualness, what makes us unique in Edo State, and try and fix it for Edo State indigenes. Domesticate interventions. Don't
Yeah.
just import for
Yeah.
financing.
We can, like what we did in this past election, we should be example, a kind of a yardstick to measure other states in Nigeria. So we should always do the right thing and set example for other states in Nigeria. So I think we have to end this program like this. Thank you, Dr. Lorenta, for that wonderful discussion. Thank you for the insights. Honorable Daniel Wadia, thank you for what you are doing, how you have been projecting the image of Edo youth. Dr. Lorenta, thanks.
Anytime.
Bye.
Thank you so much. Thank you. Yeah.
Yeah, bye.
Okay.